Okay, Namaskar. My name is Dr. Alok Roy. I'm a chairman of Medica Group of Hospitals, and we are now every weekend streaming live webinar of the current topics. And we want to interact with you. We want to let you know what is happening in the world in healthcare. As we have realized in last almost 2 years that health probably is the most important prerequisite for anything we want in life, for education, for livelihood, for anything which needs to propel our life, our country, our society. Health is a prerequisite. So we thought, why not? We come back to you every weekend and tell you what is happening. And nothing could be more relevant than Omicron at this point of time. We are in the midst of third wave. None of us, or not many of us, know what is happening with all of us in terms of infection. There's a more of a scare. There's more of a panic. There's a more of a knee-jerk reaction. There's a time when we started in 2020, when we didn't even have a test. Even RT-PCR was not established across the country. And in 2021, early when the second wave hit, we knew exactly how many people are getting infected. Today, the number which government declared, the real numbers could be 10 times more, for simple reason that everybody has got access to the RAT test, rapid antigen test. They're doing it at home. They're not even bothering about RT-PCR. So it has changed so much. From somewhere we did not know what disease is, how to diagnose it, how to treat it. Today, and every time a new wave came, the disease changed, its treatment changed. This time, again, treatment has changed. So we thought, we'll talk about Omicron. What are the do's, what are the don'ts, and what to do next? So we had, as just to give you some statistics, in Bengal, we had, in last 8-10 days, we have got 82,000 new cases. And India has got 1,41,986 new cases yesterday. Bengal got 18,213 new cases. These are just statistics. The real number could be far, far more. Not only that, what this Omicron is all about. Before I request my learned colleague, Dr. Tanmay Banerjee, to come online and tell you about in detail, and next 30 minutes, he will teach you about whatever we know about Omicron, what do's and don'ts and what next. Before that, let's look at some very basic fundamental things, whatever is happening across the world in Omicron. We know that Delta was a virus, which was basically a lung virus. It was in the lung parenchyma. But we know that Omicron replicates in the tube which goes to the lungs, the bronchioles. It's 70 times more infective because it grows that much faster. We got a new medicine, molnupiravir, was granted permission on 23rd December. Our country gave a permission and now it is available. We all know that it's helping us in cases. Dr. Tanmay Banerjee will further expand on that. The one concern which is coming, that is likely that Omicron will leave some residual effect on the body, even if it is a mild disease. That's one of the concerns which you are worried about. Only time will tell. We don't know what is going to happen. The chances of getting long COVID from Omicron are not known yet. Unlike last time when people, though had disease, they came out of it in 2 weeks, but they suffered for months and months after that. Some people have come, officially, it has been documented, suffered for 9 months to 12 months, which is unlikely with Omicron. We have to be vigilant to understand the pattern of local infection. We need to know very clearly that what is the pattern. But there are so much of knee-jerk reaction. I was just reading Bhubaneswar Municipal Corporation. They said everybody has to get RT-PCR done. They have really locked down the state. Whereas this disease may not be as bad as we really think. Is it really? Do we understand this disease? But still we are getting panicky and worried about. let's we shouldn't assume that Omicron is mild, but let's look at what South Africa experience has been. The new protocol in South Africa is asymptomatic positive cases do not need to isolate. Asymptomatic positive patients do not need to isolate. Only the mild and symptomatic patient need to isolate for 8 days. They say no quarantine required for the contacts and family. And also no need of contact tracing testing of asymptomatic patients. So much different from the part 1, COVID-1, where every contact was traced and tracked and treated. Here they say you don't have to, there's no need for contact tracing. They say don't have to really isolate asymptomatic positive patient. So that's how the disease is evolving, and probably we are at the right time to discuss with you how to deal with it, what to do about it. I have with me Dr. Tanmay Banerjee. He's the Director of Critical Care, a very accomplished person. He has treated thousands and thousands of patients in last 2 years, are completely dedicated. The very fact that he is suffering from Omicron at this point of time, from COVID infection. And as we know that now 70% of the infections are Omicron, very few, 6 to 7% are Delta, the rest we don't know what they are. So he was at home in isolation, but because we had planned it 2 weeks back, so he said, doesn't matter, I will come online. And so please forgive him for the background and all that. He is in isolation and addressing you from the isolation. With this, over to Dr. Tanmay Banerjee.
Thank you, sir. I think that was a nice introduction. Obviously, we are all worried about Omicron, and we have been seeing that a lot of our patients, not only our patients, but healthcare workers, hospital staff, our family, everyone is having some sort of symptoms like cough and cold and fever. And when we test, many are coming as positive. So the positivity rate has increased greatly. So I have got few slides to go through, but obviously I would like to keep it simple, and I would like to say that, at this point of time, we are probably sitting on some sort of third wave, which is going to come or already has come. We like to compare whether we can understand how it is going to be different from the first and the second wave. So the third wave, definitely, as Dr. Roy said, that it's probably Omicron already there in our country, and obviously sort of a lot of patients who are having COVID-like symptoms are turning to be positive, and we believe that almost 70% are Omicron at this point of time. So how it is going to be shaping, like in comparison to the first wave and second wave, is important for us to understand and know as a doctor, as healthcare workers, as sort of general public, that how we go about it and what we expect this third wave to be. Can I ask a request, please, to share my slides, please? Am I audible?
Very clearly, loud and clear.
Okay, sir. So basically, as we know that obviously COVID or SARS-CoV-2 is a virus which is obviously started from 2019 December, first discovered in China. Like any other viruses, it has got potential to change. Any virus, we have seen that with influenza and other viruses also, can change in terms of their antigenicity and their sort of antigens in various aspects of the virus structure. So we have seen previously that influenza virus, seasonal flu A and B, especially the influenza A, changes very frequently. So COVID, like any other viruses, would be expected to change in terms of their antigenicity and in terms of their characteristics. Now, we have seen, next slide please, we have seen that happening even with Omicron, we had so many strains, Alpha, Delta, Gamma, Delta Plus, and all. And every this sort of strains were a bit different from each other. And what does it mean? I mean, obviously the virus antigen has changed, say surface antigen, 32 mutations in COVID-19 compared to previous variants. What does it mean to us? What does it mean to the pandemic? That is important to understand. First of all, I think what is important to understand is that the virus is expected to change and has changed. Now, if we compare different sort of strains that we have got so far, Omicron probably has the largest number of mutations, and especially the surface antigens and on the sort of where it attaches to the cells. So it means that the virus is going to behave certainly different from the original COVID virus, which was discovered in Wuhan in 2019 December. So this virus, the new variant Omicron, is obviously different from the original one. It is more infective, definitely. It's almost 4 times more infective. But the data has shown that it is probably causing less severe disease because the mutations that make it more infectious also makes it less efficacious or capable of causing severe disease. Next slide, please. So we know WHO has definitely been tracking all these variants, and they have named variants of concerns and variants of interest. And Omicron definitely is a variant of concern, given the fact that it has the ability of infect so many people. The sheer number of patients, sheer number of infections is going to be overwhelming, though the severity may be less compared to Delta. Next slide, please. So if we see the timeline, since we have so many variants since the original COVID came in, some came up in UK, some in South Africa, some in Brazil. Delta obviously was in India last year, and now Omicron has come, which originated in South Africa and now has spread to a lot of the many different countries of the world, and everywhere it is a predominant Omicron strain that is causing the disease and the outbreaks. Next slide, please. So obviously, you all know that before we test anyone, we check for symptoms, and definitely on the PCR test or RAT test, we get positive or negative. We don't get it is Omicron or not, but there are certain sort of markers or things that we can know from RT-PCR tests that can point towards Omicron. Number one is the S gene deletion. Because it has lost so many antigens on mutation, the S gene dropout is one significant factor that can tell you that whether Omicron is it is Omicron or any other strain. Because the thing is that the genetic sequencing and all that we are sending, it takes time to come back. Nevertheless, for the larger picture, larger sort of population-based strategies, probably it doesn't matter at this point of time whether someone has Omicron or any other variants, unless we get the population-based data. But what we have to do is to go by symptomatic approach, to go by seeing how severe it is and see clinically how they are doing. What we have observed so far, and I'll show some data as well, that though we are getting large number of infections, we're getting large number of patients coming to hospitals asking for help, and those who have symptoms like flu-like symptoms, like influenza-like symptoms, having fever, cough, cold, and all, they're coming for tests, and we are seeing that okay, positivity rate has increased very significantly. But having said that, if we compare in terms of numbers of hospitalization and in terms of severity of disease, probably it is less severe than definitely the Delta. Both has got the capacity to evade immunity or vaccination even. So when we are talking about that people who are double vaccinated, who has had 2 vaccines, people who had COVID disease previously, now coming back as positive, that is expected to happen, I mean, with Omicron, because of so many mutations, it can evade the immune response, and it can evade even vaccination related antibody response or any other sort of cell mediated immune response also. So we are going to see patients who are vaccinated, who had COVID in the past also, to come with symptoms, and many of them are having Omicron. But important thing is that what we have noticed, and if we go and sort of review the literature so far available, what has been happening over the world, across the world, I think it is probably not as bad as the beta or the delta or the delta plus was. So it may be a milder variant, but it is causing havoc because it is very highly infectious. So the number of cases are too many is going to be, and given the data what we have got from South Africa, from NHS, and from other USA and European countries, what we can expect is that the number will be high, but the total number of hospital admissions may not be that many compared to the second wave or the first wave. If we just sort of think that it is going to be Omicron driven COVID wave, third wave this time. Next slide, please. Next one. So basically what
Tanmay, I think we seem to have lost him. So what he's telling in this slide is that Omicron is 2 to 3 times more capable than Delta of infecting those who have been fully vaccinated or those even who had a previous infection. But a good news is, though there's a breakthrough infection, we call it breakthrough, where the vaccination has not been able to protect you fully. But the good news, the silver lining is that Omicron were 50 to 70% less likely to be admitted in the hospital. Delta, almost everybody got admitted to the hospital. 10 to 15% population were getting admitted into the hospital in Delta. And we lost good 3 to 5% of them. Here, the admission is less than 5% at this point of time. And what data is emerging, that Omicron, it escapes the immunity. So it's a more transmissible. That means it infects more number of people, and also the immunity has less control over it. Now, immunity conferred by previous infection is less as compared to Delta, and that's how the behavior is. Next slide, please. So here they have given some comparison, which appeared in end of last month. The median age in Delta was 59. Omicron is affecting youngers more. And acute respiratory symptoms are in Delta was 91%. In Omicron is much, much lower, 31%. Because Omicron, unlike Delta variant of COVID virus was growing into the lung tissues. So lung tissues were involved. Here it is growing in the tube which carries the air to your lungs. So it is not getting into tissue and its ability to infect tissues are much lower. So as a result, the patients are less symptomatic. Duration of hospitalization is much, much lower. Patient requiring oxygen is almost nil. Very, very few patients, unless they have comorbidity and they have associated problems, the patients are not coming in who require a high level of oxygen. In fact, many places in the country, the government is discouraging, saying that when Omicron patient comes to the hospital, don't admit them unless they need oxygen. So oxygen has become a criteria for admitting patients. ICU admissions are very, very low as compared, and ventilator is almost nil. Less than 1% is nil. Next slide, please, Abhishek. The in last day rolling average was USA had 5.85, then they had 7.8 lakh new patients. And the changes in the number of patients, look at Calcutta. You all are from Calcutta and nearby areas. You will realize that everybody is getting infection. Unlike last time, when the infection, one person in the family used to get infected, he used to isolate and everybody else was safe or rather safe. Today, out of 10, 8 people, the infection has gone to every person in the family. Man is involved, wife is involved, children are involved, servants are involved, drivers are involved, and neighbors are also involved in infection. So this is shows how offensive this infection is. It will involve everybody in the population. Next slide, please. These are the some of the figures which reveal that how many people require oxygenation. I don't think it's of much relevance here. We can, but this just showing everywhere, whether it's in London, whether it's elsewhere, that ventilator, just a graphic representation, the number of people requiring ventilation at that time and now is much, much less. So we don't expect this disease to be very, very severe. So when we said do's and don'ts and what next, disease is not severe, but it is highly infective and it affects the people who have a lot of comorbidities. Now, somebody asked, Mr. Kaushik Mukherjee just asked a question, how we can protect elders, individuals from Omicron who have some respiratory problems. So as I said earlier, the Omicron doesn't grows into the tissue, it grows into the bronchioles. So the chances of lung getting involved are not there. But the bigger problem is we don't know that the present virus which the man has is Omicron or Delta. If it is Delta, then it's going to affect more, create more morbidity and going to make people more sick, because we still have enough Delta in the system and roaming around the system. So it is important to protect all those who are elderly, who are not properly fully vaccinated, or those who have serious comorbidities. So those people have to be still protected till we are sure that Delta has gone completely. Next slide, please. The Indian scenario, India has crossed its first wave peak of daily new COVID cases on 6 January with 1.17 lakh cases reported. 1.17 lakh cases reported. Yesterday, we reported 1.41 lakh, rather 1.1 lakh 42,000 new cases were reported yesterday. First wave took 120 days to double, 1 lakh cases. Second wave took 50 days, and third wave took less than 10 days. So you can understand how severe the Omicron in terms of infection level is. Next slide. And as you can see, the peak, it just compared the previous peak. The numbers are very, very high with the current testing capability. But let me tell you, today, very few people, probably 10 or 20% people are getting RT-PCR done. 80% of the population at home is doing a RAT test, rapid antigen test. So as a result, what is happening that we don't know, there's no documentation. And those people have fever, mild throat irritation, or somebody was asymptomatic, or somebody got in the house, they did a RAT, they found positive. Now, unlike last time, when we could operate on a patient who was negative, and he would be negative till he goes home, today, this time, the patient who comes in for surgery, he comes in negative on the day one, we operate on him on the same day, next day becomes positive, and third day we discharge him. That means though he's positive, his condition is not that bad that he needs to be kept in the hospital, which is a huge departure from last time. Last time, if the surgical patient got COVID, we were scared to the bone because we knew that we might lose this patient because they had all kinds of problems, bleeding, infection, and low immunity, and their immunity was beaten so badly. So, but this time it is not happening. They're all going home, and we are discharging them. In fact, on the scheduled day of discharge, we discharge them. So that's a Omicron. Maybe it's a gift to mankind. Next slide, please. We feel that our daily number of patients are increasing, but what behavior it will exhibit, we really don't know. So let's hope that the model they have been projected here, they say that Indian daily cases are depending on those who are who have been given immunization or not given immunization. Those who are 100% susceptible, they have got much less, much more infection than those who are less susceptible, those who have been vaccinated. That's what it means. So those who are unvaccinated are at higher risk. Children are at a huge risk at this point of time. And we are getting some children coming in. Tanmay, are you back? Can you hear me, Tanmay?
Thank you. Yeah, sir, I'm back. Yes. Sorry,
Okay,
got
so
disconnected.
next slide and you can continue. Tanmay, over to you. Abhishek, change the slide. Yeah.
Yeah, I mean, the thing is that, can we go to the next slide? I think, obviously, about Omicron, a lot of discussion has been happening, and we know what to sort of expect a very large number of patients, but maybe less severe ones. I would like to just show what they have done in a statistical institute in Bangalore. They have projected the potential number of patients that we can expect over the next 1 month. So we can see the peak. The peak is very close to us now, almost sort of beginning of February, maybe what we are experiencing here in Calcutta and across the metropolitan cities, that the peak probably would come even earlier than that, even would come middle of January in next 1 or 2 weeks. So we can expect that projected number of patients to be very high, and the peak is going to be coming sometime this month, and then gradually it will go, and as soon as it sort of starts coming down, it will probably sort of take 2 to 3 weeks to for it to disappear. That is what we can expect. We have seen that in second wave also, but this is totally different because Omicron has a very, I would probably like to highlight that it has a shorter incubation period. So it can infect you once you get the virus, and you can start have the symptoms by 2 or 3 days of time since getting exposed. So the incubation period that we call is that from time of exposure to time of disease or time of symptoms, it is much less than Delta. It is less than 3 days or average maximum up to 3 days. So the peak is going to be quick, and once the whole of the population sort of gets affected, social susceptible ones, it will gradually, obviously, it will go off. Important thing is to consider is that the patients who are vaccinated and who have had previous COVID are going to have less severe infections. Our worry is with patients who are having comorbid conditions like diabetes, heart disease, kidney problems, liver problems, and elderly ones, as well as with children also. Because children, we don't know, they're not vaccinated yet, mostly, and it can cause significant symptoms, at least in children who are not vaccinated. And we may expect a large number of pediatric population to be infected and coming to hospital, as we have seen in other countries, including the United States of America. Next slide, please. Next one. The main worry for us is that what we do, obviously, it's going to be a burden, huge burden on healthcare. It's going to be a huge burden on economy. It's going to be sort of a quite lot of loss of working days for the working population, working class population, as well as in hospital. For us, it is important to know and important to consider how we are going to sort of deal with it over next few weeks. Though it will come quickly and go quickly, but we have to be prepared. So for individual persons, obviously follow all the COVID precautions. We have to wear masks, keep distance, keep our sort of what we have been doing so far over the last 2 years during the pandemic. We have to do it more, and we'll do it more stringently because it's more infectious. Obviously, getting vaccines and all that is important, but more importantly, to follow social distancing, follow mask, use mask, maybe possible in the hospital, use double mask, use N95, and as well as surgical mask in clinical areas, and any symptoms you to screen. Next slide. So actually, in terms of an hospital, we have to have a proper triage system that we are already doing in Medica. We have had a lot of discussion about having adequate equipments, essential drugs, and everything in place so that we are prepared to deal with this pandemic. And as we have seen, as we have expected, that the number of patients are going up. I mean, the ICU admissions may not be that high if we compare to the total number of cases, but definitely it is going to be going up with time, because a lot of patients will be affected, a lot of people will be affected, a lot of people have the disease, and because of their comorbidities, I mean, say elderly ones having kidney problems, patients on dialysis, they will definitely need some form of ICU care, and we have to provide that sort of logistics also. And apart from the beds, we have to have the medicines, drugs, and every manpower in place. That is one of the challenges. We are trying our level best to work around that. And we have seen that patients who are coming in, even for antibody cocktails, for other treatments and things, if they're not in ICU, if they're in a ward, their actually turnover time is less than the first wave and the second wave. So they are going home earlier. As we have seen also by what the guideline the government of India has published, that from now on, 7 days from day of testing, you can come out of isolation. And even going out of hospital, if you are 3 days symptom free, you can go out of hospital, and even if it is 7 days from your day of testing, you can come out of isolation. So we can see that the turnover time or the duration of illness is probably less with this current Omicron variant, though it is more infectious, and the incubation period or the disease onset is quicker than the previous variants. Next slide, please. So what we have to do is that, obviously, not to panic. As a hospital, as individuals, as healthcare workers, obviously we have the responsibility to serve our population, serve our patients, and but be prepared also. So not to take it lightly, we have to be prepared. We can see that the first wave was definitely quite bad. Second wave came quicker. Third wave, the doubling time, the number of cases are increasing exponentially, and it has reached this kind of figure. What the chairman sir was mentioning, that within 10 days, it has just crossed more than a lakh. And in Calcutta, it has crossed 15,000 in West Bengal. And I'm sure it is going to be sort of going and hitting higher numbers. So you have to be prepared to deal with this high number of patients. But having said that, we have to safeguard our healthcare workers, our doctors, our nurses, and everyone has to follow the protocol. That is what we are at in our hospital, in Medica. Obviously, we are sort of trying to adhere and try to adjust to the system and adhere to maximum protection for our doctors and healthcare workers. Next slide. So lockdown may not be a possibility or may not be immediate option for the government to consider or announce, but we have to ourselves understand that we are almost nearing a near lockdown situation. So we have to avoid unnecessary travel, unnecessary sort of attending outside or going to sort of places without, unless we have forced to do it or unless we need to do it. Next slide. So I just quickly conclude this discussion. I mean, the thing is that we know that for last 2 years, things have been sort of going up and down. Every time we expect, okay, the COVID is getting better. Few months, things are looking all right. Then a new strain or new virus comes. And then again, it is back to like the previous waves, first wave, second wave, now even third wave. So what's next? I mean, is it a good news? Is Omicron is a good news for us? In some aspect, maybe, because it has the potential to infect lot many people, but cause a less severe disease. So in that sense, it can give a natural immunity or like a natural vaccine to the population who are not yet vaccinated, or it like may serve like a booster dose. That is one good point about it. And as it is less severe, as we have seen in South Africa and also Europe and US, and also we are seeing here in Calcutta and in India, that number of hospitalization ratio to the affected patient is lesser, much less than the previous waves. So we can expect that it should not be too bad for us. But at the same time, we don't know and cannot be completely sure about the future, because COVID, like any other virus, has the tendency to mutate, and the way it will behave, we have to wait and watch. There are some possibilities I would like to tell all of you, that possibility number one, that is, it can be like a common cold or a flu-like illness, continue to be endemic in future years. It can behave like an influenza-like illness, where you get seasonal viruses, like childhood viruses, where it actually infects people, and when they're young or at some point of time during their sort of lifetime, and they have some sort of immunity to the virus, and then they actually tend to do well and are not coming to hospital. So like we have seen like mumps, measles, and other respiratory viruses, where it is a childhood disease, people get infections, people get vaccinated, then people are doing all right. So it can change. I mean, obviously, if it mutates further, like we have already seen some new variant in France called IHU, which has more mutations, but it hasn't been proven to be more serious or more worse than the OMICRON. So in future, I think we can expect it to stay. It will probably be an endemic disease. That means it will circulate in the community. It will be there with us, and there will be outbreaks during particular time of the year, or some smaller outbreaks than what we are seeing now. Or apart from that, it can also be prevalent like a zoonotic disease, where it will go back to circulate in the sort of animal population where it came from. And then again, time and again, it might get mutations and come back to infect the humans, infect us. So these are possibilities that scientists are actually discussing, and the experts, what they are saying. And obviously, we have to consider that it is still early to say, but best case scenario, I think it could at least sort of point to some sort of peak over next few weeks. And then at least for some period, we'll have some respite, we'll have some sort of good news for all of you for a few months at least, and for maybe many months expectedly, I hope so, where COVID will cease to be a sort of significant disease for us in the healthcare sector and in terms of the whole population. But obviously we have to be vigilant, and it can always come back. It has behaved in sort of very erratic way, and it can still continue to behave in very different way. But still, experts, what they're saying and what we are gathering is that probably it is going to be not such a bad news for all of us at the end of this third wave. Thank you. Thank you, sir.
Thank you, Tanmay. It was a very lucid presentation, and you brought out all the salient features. Can I ask you a question that how will you react to that? A lot of people are worried, and we are seeing also a lot of children who are getting infected and coming in. What's your view on that, about children getting the Omicron and the disease?
Yes, sir. I mean, the thing is that, first of all, children, they are not vaccinated. So obviously, they are more prone to get the infection. And we have seen, I mean, in India, the data is not yet available that much with us, but we have seen that in US, the number of pediatric admissions into the hospitals have increased significantly. The thing is that given the fact that children, they have less comorbidities, they have a good immune response and all, most of them will be fine. But if any child is symptomatic, and if they're having very high fever or sort of COVID-like symptoms and running high temperatures, then I think it is very important to be very careful, not to take it lightly, because we are still early in the pandemic, early in this sort of third wave, and things are not entirely clear how the disease will behave in children. So we have to be vigilant and we have to be careful.
Thank you, Tanmay. Tanmay, what is your advice to the elderly with a comorbidity and fully vaccinated? What do you think about them, and what will you like to tell them?
First of all, I'll definitely like to tell them, all of them, that please be careful, be vigilant, and follow all the precautions, and sort of be very sort of having low threshold for testing if you are having symptoms, because it is good to know if you are having COVID or not. Because sometimes what happens is that we have seen that patients are coming quite sort of after many days of symptoms, and they have not tested previously. So testing is important, precautions are important. For those who are having COVID positive, I think seeking medical help early is important, though we have not that many medicines or sort of new weapons or medicines to offer to them. But then having said that, I think early vigilance and early monitoring is important, and they should definitely take the booster dose once that it is available, because it will at least protect against severe disease, whether someone gets it or not. Though it may not protect against infection, it protects against having severe disease and severe illness. That is the thing. And antibody cocktails, new drug, molnupiravir, those are options. Definitely these they have not included in the national guidelines yet, but it has been shown in some previous outbreaks, and also is part of the guidelines in US and UK and other also European guidelines as well, that it may be useful, may be effective, especially if someone is having high risk of having sort of severe disease. How effective it is against Omicron, I sort of really haven't seen much data against or for it, to be fair. So people say that it may not be effective against Omicron because it has so many mutations, but also studies are not there, so nobody knows. But having previous experiences, it may be useful for patients with comorbidities in preventing severe disease.
Thank you, Tanmay. Thanks for a very nice presentation, clearing a lot of doubts and telling us what to expect from Omicron with all the knowledge available to us so far. And thank you all, our participants, please stay tuned to us every Saturday, 5:30 to 6:30. We'll come back to you. We're more, what are the current topics concerning healthcare, and we'd like to take it to you directly. Please ask as many questions as you can. Send us questions, as I said in the chat, 74396 00616. 74396 00616 is our WhatsApp number. Send your queries. Any query, we'll respond to it and get back to you as soon as possible. Thank you. Have a nice day. Namaskar.